Hi, good evening. My name is Suzanne and I'll be doing the HENT video assignment for this week. So, hi, good morning. My name is Suzanne and I'm going to be your student nurse practitioner today doing your head, eyes, ears, nose, and throat examination. I will be videoing this assessment and I would like to get your consent if you're okay with it. Okay. So first start is, of course, I would wash my hands and then, of course, introduce myself to the patient as I've already did. And we usually start with the head. So assessing the head for its contour, its shape, assessing if there's no signs of trauma or deformity, especially the skull, the occipital area. Also assessing for hair distribution, making sure that, presence of lice or anything like that, or any pain or tenderness that you feel. And then after that is we're going to be checking for visual acuity. So usually we would using a Stelling's chart. So right now we just have the portable one. So I would ask the patient to hold it arm's length. So can you please hold it up? And then hold it up for me. And then cover one eye. And can you read the smallest letter? Arm's length?
No, this is how I read it. I can't read it if it's that far. LTFPH.
And then the other eye?
LTFPH.
Okay. And then we're also going to inspect the eyes, of course, making sure that the iris, they're like the color, it's not yellowish or anything. There's no lacrimal duct, that there's no blockage for the lacrimal duct. We're also going to check the conjunctiva. My patient's very sensitive. Making sure that it's pinkish in color, there's it's not swollen, or there's no tenderness or signs of infection. And then after that, we're also going to check for pupil reaction to light. So using my pen light, checking for pupillary reaction to light directly and consensually. So usually what we would do to test this is that I would be using my pen light. I would flash the light to my patient's left eye, and it should constrict, and then the right eye should also constrict, and also the same way. Pupils. Next is also we're going to be checking for extraocular. What also we can do is also test for light accommodation. So I would ask the patient to look straight like a faraway object, and I would be checking checking his eyes, making sure that it's even. It's usually like nasal for his vision, and also checking for any signs of it's not balanced or something like that. Also then we will be checking for extraocular movement. So I would be asking the patient to look at my finger and follow it without moving your head. Okay, so this way, checking. Okay, and also checking that patient's visual field. So usually I would, can you tell me when you can see my fingers? And also this way, making sure it's equal on both sides. And next, using our ophthalmoscope, we'll be checking, of course, for like red eye reflex. And then after you have that, you move closer to the patient. So patient's left eye, right eye, and then my left eye and my left eye. Okay. Checking for blood vessels, making sure they're intact. Checking the optic disc. Okay. And I would also do the same on the red reflex. Yep, I see it very well. And then on the other side as well. Okay. And that would be for the eyes. Now we're gonna go to the nose. So we're gonna check. Usually what I would start is, of course, you can look at the nose, its shape, and do palpation for the frontal sinuses, making sure there's no tenderness or any pain, it's not swollen, and also the maxillary sinuses. Any tenderness or pain that you feel? No. And again, also using my, I would use my otoscope. I would inspect the mucosa. Can you put your hand down and tilt up a little bit? Checking for any nasal sinuses that are swollen or any deformities or signs of infection. Okay, and also we can also test for airflow or smell, making sure that the patient doesn't see what we have here on the side. So we usually, when we test for the olfactory cranial nerve, is that we would ask the patient to close his eyes. Can you please close your eyes? Put your hand down, and then covering one side of the nose, we would ask the patient, can you smell this? What is
Coffee.
it? Coffee. And then on the other side, can you please put your hand down?
Cinnamon.
Okay, and we can also do that. So that would be for the nose, and next is for the ears. Of course, so first thing we need to do is inspect, making sure the external parts of the ears, there's no signs of inflammation or signs of infection, there's no deformity or anything like that. And again, using our otoscope, we would check. So for adult patients, we would pull up and back, and then visualize, making sure, okay, looks clean, and also visualize the what do you call that, the tympanic membrane. And also we would do the same thing on the other side. Now for children, we would usually pull down and back. After that, of course, you have to change the this one for each ear. Okay, and next is we will test for hearing test. So we're gonna do first the Weber's test. So make sure that the patient can hear it laterally on both ears. Can you hear it? No? I'm sorry, this is...
No. No. Don't touch it here. Touch it here.
Can you hear it? Can you hear it?
No.
Well, I think this is a little difficult, but when I put it here, the patient should be able to hear it laterally equally. And then for the rinse test, so same thing, you're using our tuning fork. Air conduction should be longer than bone conduction. So put it here on the back of the patient's ear. Can you hear it? Tell me when you don't hear it anymore. And then, can you still hear it? It should be on the same side. So as I said, air conduction should be longer than bone conduction. So that would be for the ears. Next is we're gonna go to the mouth. So, you know, of course, we check also for TMJ. You ask the patient to close and open his mouth, making sure that they're okay and they're not like disaligned or anything like that. Inspect the lips, of course. Inspect dentition. Can you open up your mouth? Okay. Making sure that everything's okay. Inspect the tongue using a tongue depressor. You can also check, you know, can you stick your tongue out and say making sure that the tonsils are midline. I mean the uvula are midline, the tonsils are not inflamed, or there's no signs of infection or exudates, and also tongue strength are equal. So you can also check on that. And next is we're gonna inspect the, yes, of course, you can also inspect the throat, of course, using a light and all that, okay? And next is we're gonna check for the neck. Yes, so of course we're gonna be checking for lymph nodes. node. So we start with the
Okay lang. HENT.
what is that called?
Okay.
Preauricular nodes, using the palms of my three fingers, palpating them that there's no tenderness. Post-auricular, tonsillar, check, and then submandibular, submental, and then the anterior cervical, posterior cervical, deep cervical, which you can also ask your I'm sorry, ask your patient to turn the side. It's really deep, you might not be able to feel it. Then also check for the subclavicular, infraclavicular, and also the occipital. You can also check for cranial nerves right here, like make sure that the patient can shrug the shoulders, strengthen everything, and also that the thyroid is what do you call that?
Great.
No.
Pharynx.
No, the
Epiglottis.
that it the trachea is midline.
Trachea.
Trachea. The trachea is midline, and you can also check for goiter, usually on the back, and palpate. Sorry, my patient's very sensitive. So that's how you would do an HEENT assessment.
Okay.
Thank you.